A lot of discussion about the various tactics used to combat the pandemic, and that discussion and that analysis should continue, both to make sure we do the best with this coronavirus pandemic and also to prepare for any future crises that may come our way. And there's been a lot of focus on Sweden because it's had a relatively laissez-faire approach to combating the COVID-19 pandemic. And this article from Reuters today summarises a year's worth of data now. It says that Sweden, which has shunned the strict lockdowns that have choked much of the global economy, emerged from 2020 with a smaller increase in its overall mortality rate than most European countries. This is an official analysis of data sources. Let's go then to Peter Collignon, Professor Peter Collignon, our resident infectious diseases expert, to interpret this for us. Thanks for joining us again, Peter. Sweden has seemed to be at the sort of the least restrictive end of the pandemic response. Do these figures show that it was right to go that way?
Well, I'm not sure it shows it was right, but Sweden has been pillared by a lot of people because they haven't had the same lockdowns and restrictions as a lot of other European countries. But I guess what this data shows, at least within Europe, Sweden has not fared worse than most other European countries. In fact, has done a bit better. Now, it depends how you compare them. If you compare them to other Scandinavian countries, Denmark, Norway and Finland, they actually have done worse. They have had more excess deaths relative to those countries that have had more restriction. But compared to places that have had quite severe lockdowns, Spain, Italy, even France, they actually have done better. If you look at it in the Australian context, I've always had the view, and I expressed it about a year ago, that we shouldn't go the New Zealand approach, which was lock down hard and go for elimination, have really prolonged, restrictions, as Victoria went. More like the New South Wales approach, just try and knock it on the head when it goes. But even if you look at Victoria, the state that had more cases than anybody else and more deaths, they had about 800 deaths, and that's in a population of just over 6 million, versus 13,000 deaths in Sweden with a population of 10 million. So it's much worse than anything we've had in Australia. And if you look at New South Wales, which I think is an example of a halfway doing it between the New Zealand approach and the Swedish approach, 50 deaths in a population of just over 8 million. So I'm not sure, I think in some ways the approach Australia has had, which is, and now only New South Wales is really doing, which is, look, we'll control this as much as we can, Australia as a whole controlling its borders until we get a lot of the population immunised. And that's very important for the risk people before winter, because I don't think anybody can really know where we're going to be till probably April next year. But so far, I would think in Australia, we're in a better position than Sweden, and economically and socially, we've done better than, say, the places that have had tighter lockdowns, such as New Zealand or Victoria even, without necessarily any more cases and a worse result for going a bit more middle of the road.
Of course, the massive advantage we had compared to places like Sweden, anywhere in Europe, of course, is our island status. The way we've been able to cut ourselves off from international arrivals.
Yeah, well, that's a big factor because we can control our borders probably better than a lot of other countries. And I guess being in the EU, that made it more difficult for countries like Sweden as well. But by the same token, there's a lot of places that were sort of islands. Israel, for instance, was relatively isolated with its border, but it had big outbreaks after initially doing well. And we need to be a bit careful too, because this next winter is going to be a test. We don't want to become too blasé or too overconfident, because we do need still, I think, restrictions till the end of the year of some form. Admittedly, they can be low at the moment because we don't have any community transmission. But when winter comes, we're going to actually have to be more vigilant and accept maybe decreased crowds at football matches and inside pubs, etc., because I think that is a risk. Luckily, I think we'll have 6-7 million people vaccinated before June, July, which are the people that are most likely to die, and that's the most important thing we have to do in the next few months.
Yeah, I'm going to shock myself here and some of the viewers, I think, because I'm always arguing for lifting restrictions, but I'm just wondering now, they're looking at maybe 75,000 people at the MCG tonight and dropping more restrictions in New South Wales. Is this a bit of a folly? Because once we get into winter, there's likely to be more outbreaks. We're going to have to start putting restrictions on again.
Yeah, look, I mean, I've been accused of being too loose with restrictions myself, but I actually think these, going back to big crowds, oh, look, it's normal because we don't have any transmission. That's true at the moment, but it can so easily spread. I mean, if you look in New South Wales, they had that spread in the northern beaches. It probably was there for a week or more before it really realised it was there. So particularly in winter, I think having huge crowds, outdoors is much safer than indoors, but I would think having crowds of more than 50% capacity and, you know, because there's all the, how do you travel? You know, what are the going to the bars and pubs afterwards? All those sorts of things are just as important as the crowds at the venue. So I actually think this winter, we shouldn't go back to normal. I think we need to take extra precautions this winter, see how it goes, and hopefully, you know, the winter of 2022 will be reasonably back to normal. But I'm not sure that this year we should be too lax with our restrictions.
Thanks for joining us again, Peter. Appreciate it.
Thank you.
Peter Collignon there saying, just go easy. Don't take off the shackles too quickly and too loosely over winter because this virus is still out there.